Today, we're talking about a silent killer that claims millions of lives every single year, sepsis. But here's the thing, there's a new battle plan. We're about to break down 5 major, practice-changing updates from the 2026 Surviving Sepsis campaign that are totally set to redefine how we fight this deadly condition.
And if you want to know why these updates are so critical, just look at this number, 11 million. Sepsis is a massive global health crisis responsible for an estimated 11 million deaths worldwide each year. That's about 1 in every 5 deaths globally. It's a staggering figure, and it's exactly why we need a smarter, more unified response.
Now, here's a really crucial point to understand. Sepsis isn't the infection itself. It's the body's overwhelming, life-threatening response to that infection. You can think of your immune system suddenly going into hyperdrive, switching from being your protector to actually attacking your own body and damaging your organs. And that is the devastating reality of sepsis.
So, here's our game plan. First, we'll get into why sepsis is such a hidden emergency. Then, we'll look at the global campaign that's driving all this change. After that, we'll dive into the 5 big, life-saving updates. That's the core of what we're talking about today. And finally, we'll wrap up by looking at what this new standard of care really means for patients.
Okay, let's start with the urgency. Because when sepsis hits, every single minute counts. It is an absolute, high-stakes race against the clock to prevent permanent damage.
What's happening inside the body is this devastating chain reaction. The immune system just floods the body with inflammatory chemicals. This causes tons of tiny blood clots that start blocking blood flow, basically starving your vital organs of the oxygen and nutrients they need to survive. And that's what leads to that deadly cascade of organ failure.
But the good news is there's a coordinated global effort to fight back. And that brings us to the organization that's behind these groundbreaking new guidelines.
So the Surviving Sepsis campaign isn't just some small, local effort. No way. This is a global collaboration of the world's top experts. They pore over all the latest research to create these evidence-based guidelines, which help set a unified, high-quality standard of care pretty much everywhere.
All right, now for the main event. Let's really get into it and unpack the 5 specific updates that are about to change how sepsis is treated on the front lines.
First up, a major change in one of the most fundamental treatments for sepsis, how we give patients fluids.
I mean, just look at the difference here. On the left, you've got the old way. Just flood the patient with huge amounts of IV fluids, a one-size-fits-all approach. But look to the right. The new way is so much smarter. The 2026 guidelines are all about a more conservative, personalized strategy, tailoring fluids to what each individual patient actually needs.
So, why the big shift? Well, we've learned that too much fluid can be just as dangerous as too little. It can cause fluid overload, which can really damage the lungs and kidneys. So the new solution emphasizes what we call dynamic assessments, things like checking how the heart responds to a tiny bit of fluid to figure out if a patient is actually going to benefit before we give them more.
Okay, on to update number 2. This one completely rethinks the timing of some really critical medications that support blood pressure.
The old way was pretty sequential. You'd give fluids, wait to see if it worked, and then maybe start vasopressors. Those are the meds that help raise blood pressure. But the new way? Totally different. It says for patients in septic shock, you start those vasopressors early, right at the same time as the initial fluids. No more waiting around.
And the reason for this is simple. We have to protect the organs. Severe low blood pressure, or hypotension, is like a direct assault on the body's most vital systems. By starting those vasopressors sooner, we can prevent or at least shorten that dangerous period, making sure the brain, heart, and kidneys keep getting the oxygen-rich blood they need to survive.
The third update zeroes in on getting straight to the root of the problem, the infection itself. This is all about what we call source control. That just means physically getting rid of the source of the infection, like removing a ruptured appendix. And the new timeline here is aggressive. For really urgent, life-threatening infections, think flesh-eating bacteria or necrotizing fasciitis. The goal is to intervene within just 6 hours. For other cases, it's within 12. The clock is ticking.
All right, update number 4. This one brings some much-needed clarity to a treatment that's been debated for years: corticosteroids.
For a long time, using steroids in sepsis was, well, it was a mess. There was a lot of controversy and nobody was really sure what to do. But now, there's clarity. Based on solid new evidence, the guidelines now clearly suggest using low-dose corticosteroids, but specifically for patients in septic shock who continue to need those vasopressors to keep their blood pressure up. And finally, we've got the 5th major update.
This one tackles one of the biggest challenges in all of modern medicine: how we use antibiotics.
The new antibiotic strategy is both aggressive and really smart. In that first hour, you hit the infection hard and fast with broad-spectrum antibiotics. But then, and this is the key, you don't just set it and forget it. The focus shifts to daily de-escalation. And now, the guidelines highlight using tools like the biomarker procalcitonin, or PCT, to help doctors decide when it's safe to narrow down or even stop the antibiotics altogether.
And this two-pronged approach is just brilliant. It makes sure the patient gets the effective treatment they need right away, but it also helps us fight the huge, growing threat of global antibiotic resistance. It's about using these incredibly precious medicines as wisely as we possibly can.
So when you put all 5 of these changes together, what do they really mean? Well, they signal a huge, fundamental shift in the entire philosophy of how we treat sepsis.
This quote really just says it all perfectly. We are moving away from those rigid, one-size-fits-all protocols. The new standard of care is all about being personalized, dynamic, and responsive. It's about tailoring treatments to the individual patient and what their body is telling us in real time. And it really feels like we are. By embracing this smarter, more individualized approach across the board, these guidelines are a massive step forward. Which leaves us with a really powerful question to think about. With these changes, are we finally, truly entering a new era in the fight against sepsis?